Today we are going to learn about shock. What is shock? Shock is basically decreased blood supply as the result with the problem of circulatory system. So first is definition. Shock is the state of insufficient blood flow to the tissues blood flow to the tissues. Shock is the state of insufficient blood flow to the tissues of the body as a result of problem with the circulatory system. As a result with the problem with the circulatory system. The problem of circulatory system. Now, second point is classifications of shock. Classification of shock. Shock is categorized as first hypovolemic, hypovolemic shock. Second is hemorrhagic shock. Third one is cardiogenic shock. Fourth one is neurogenic shock. Fifth is septic shock. Sixth is anaphylactic shock. Now, how to approach patient of shock? So whenever the patient comes, look for the generalized symptoms in the patient of increased anxiety, rapid shallow respiration, and reduced higher functions. First thing inspect the patient is to look for carotid pulses, peripheral pulses, and temperature of extremities. Then apply an EKG monitor and monitor vitals of the patient's stat. Look for JVP of the patient clinically or insert a central line and look for CVP of the patient. So the symptoms, what we have to look for, symptoms will be common symptoms. Increase anxiety, rapid shallow respiration, and reduced higher functions. And always look for carotid pulses, peripheral pulses, and temperature of extremities. Whether the patient is having cold and clammy skin, cold or clammy skin. Then look for EKG monitor and monitor vitals of the patient's stat. Vitals of patient stat. Also, look for JVP and insert central line if needed. Okay. Now fourth one is, let's learn about shock index. Shock index. The formula for shock index is heart rate upon systolic BP, and its normal range is normal shock index is 0.5 to 0.7. 0.5 to 0.7. Greater than 0.9 shock index leads to higher mortality. In shock due to fluid loss or decreased peripheral resistance, cardiac output decreases and hence pulse rate increases, which causes shock index will increase. Therefore, higher shock index indicates higher mortality. Then there is, now we go with modified shock index. Nowadays we go with modified shock index, and the formula for modified shock index is heart rate upon MAP, and formula for MAP is diastolic pressure plus 1/3 of pulse pressure. So this is the formula for modified shock index. We calculate by using this formula, and this is most sensitive indicator. Now there is one more. There is one more indicator, that is rope. Rope is rate over pressure difference. Rate over pressure difference and is calculated by formula pulse rate upon pulse pressure. So what is pulse pressure? Pulse pressure is systolic BP minus diastolic BP. Normal pulse pressure is 120 minus 80, 40 mmHg. It's normal pulse pressure. So if the rope is less than 3, then the patient is stable patient, and if it's greater than 3, it suggests decompensated hemorrhagic shock. Decompensated hemorrhagic shock. Now we will learn about stages of shock. There are 4 stages of shock. It's a pathophysiology. So there are 4 phases. First is initial phase. Second is compensatory phase. Third is decompensated phase. decompensated phase. And fourth one is refractory phase. So now we're going to learn about each phase. First is initial phase. During this stage, the state of hypoperfusion, what happens in this phase? These cells are receiving the less amount of oxygen. That will lead to hypoxia. So what happens in the stage? In initial phase, there is hypoperfusion, which leads to hypoxia, and due to the lack of oxygen, the cells perform lactic acid fermentation. Due to lack of oxygen, cells perform lactic acid fermentation. Because why? Oxygen is the terminal electron acceptor in the electron transport chain and is not abundant. So this slows down entry of pyruvate into the Krebs cycle, resulting in its accumulation. The accumulating pyruvate is converted to lactate by lactate dehydrogenase, and this lactate will cause lactic acidosis. So what happens in the initial phase? The cells receive less amount of oxygen, that is hypoperfusion, that will lead to hypoxia. Lack of oxygen, cells perform lactic acid fermentation because the electron is the terminal, the oxygen is the terminal electron acceptor in the electron transport chain and is not abundant. This slows down entry of pyruvate into the Krebs cycle, resulting in its accumulation, and the accumulating pyruvate is converted to lactate by lactate dehydrogenase, and this accumulating lactate causes lactic acidosis. Now what happens in compensated phase, stage second? This increased acid in body increases the ventilatory drive of patient, and thus the body tries to compensate for acidosis component. And so what happens? Body tries to compensate by ventilatory drive of patient. And there are baroreceptors that detect hypovolemia and thus cause increased sympathetic drive by adrenaline and noradrenaline, thus leading to peripheral vasoconstriction. Yes, vasoconstriction, but there are some exceptions. In neurogenic and septic shock, there is no vasoconstrictions. We will see about it later. And these vasoconstrictions lead to cold extremities. So what happens? Second, we have to see. As a compensatory mechanisms, there are baroreceptors in our body. Baroreceptors which detect hypovolemia, that lead to increased sympathetic drive by adrenaline and noradrenaline, leading to peripheral vasoconstrictions which lead to cold extremities. Cold extremities. So this is all about compensatory phase. So now the important point in compensatory phase is, what about the urine output? So urine output will increase or decrease? It will decrease. Urine output will decrease. Why it will decrease? Because the renal system is not receiving the abundant amount of blood. So it is decreasing because of lack of blood supply to the renal system. Lack of blood to the renal system causing the characteristic low urine production. And now the question is, what about the RAS system? The RAS system, that is renin-angiotensin system, takes time and it will not show hemostatic mediation of shock. So what happens in decompensated phase? If the shock progresses into decompensated phase, here, if it's not corrected, then here cells begins to die. Cells begins to die and cells will secrete potassium into the blood, so there will be increase in amount of potassium. Cells begin to die, also increase in amount of potassium, that will lead to diastolic arrest because potassium is an intracellular ion. The arrest of heart. And also it will end up into metabolic acidosis and there will be multi-organ failure as well. So now the last phase is the refractory phase. So what happens if we didn't treat the shock during initial phase, compensated phase and decompensated phase? Then at this stage, at refractory phase, this stage, the vital organs have failed and shock can no longer be reversed at refractory phase. There will be brain damage, cell damage, and therefore death will occur imminently.